My name is Valerie Graham, and for my quality improvement project, I chose postpartum hemorrhage. The clinical agency was Covenant Medical Center, a 645-bed hospital located in Saginaw, Michigan. The birth center has 40 beds in the postpartum unit. My QI focus was to identify the use of Pitocin in prevention and treatment of postpartum hemorrhage, in addition to ways to improve gaps in practice. As a student nurse, while completing this project, my role was to identify an issue within my scope, which in this case was a postpartum hemorrhage. I received assistance from my project from my preceptor, who was also a unit facilitator. She offered support, data, great ideas, and challenged me. With assistance from my preceptor, the birth center unit educator, and the labor and delivery unit manager, I was able to collect data about policies, procedures, statistics, and research evidence based practice and implement changes in the clinical settings to help improve the effectiveness of postpartum hemorrhage treatment and potential outcome. A postpartum hemorrhage is one of the leading causes of maternal death for women and responsible for 11.2% of maternal deaths in the United States. 40% of postpartum hemorrhages occur in patients without any risk factors. Risk factors that contribute to postpartum hemorrhage is limited to no prenatal care, anemia, multiple pregnancies, short interval pregnancies, home deliveries, placenta previa or abruption, and infection. Oxytocin given between delivery of the infant and the placenta is the most effective intervention to prevent postpartum hemorrhage. This is known as the third stage of labor. Per covenant policy, patients are to receive Pitocin via IV for 8 hours postpartum following a delivery. Gaps in practice that I identified was Pitocin not administered during third stage of labor due to home births or no IV access or refusals. Another one was a risk assessment not completed or up to date due to limited prenatal care or updates not made in labor and delivery and reported off to the postpartum RN at handoff. In the state of Michigan, the Michigan Alliance for Innovation on Maternal Health, which also known as MyAIM, equips hospitals with best practices, including protocols and staff education, to make birth safer, improve maternal health outcomes, and save lives by implementing both hypertension and hemorrhage patient safety bundles. My PCOT question: in postpartum women at risk for postpartum hemorrhage, how does the use of Pitocin after delivery for the first 8 hours compared to postpartum women who were not treated with Pitocin affect postpartum hemorrhage rates, complications, and mortality rates during the postpartum stay in hospital? My evidence-based practice model was the Ottawa model of research. This model includes 3 phases. The first, assessing barriers and supports while considering the evidence-based innovation. This is where the barriers are identified of what are the risk factors for mothers developing a postpartum hemorrhage. The second phase is monitoring interventions and degree of use. By monitoring the interventions of obtaining more frequent risk assessments, administering Pitocin in postpartum, and following postpartum protocols. The third and final step is evaluate and monitor patient, practitioner, and system outcomes. That this is where the evaluation of the interventions put in place are identified and if they were desired outcome. The project description was to reduce the risk of a postpartum hemorrhage and administer Pitocin. Things that we did were we educated staff to conduct risk assessments of all patients on admissions and with a change in condition. We implemented a nursing handoff of documentation and bedside assessment. At this time, nurses were encouraged to keep their documentation up to date. So when their handoff with the other nurse, it was accurate. The third one was chart audits of checking IV patency, initiating administration of IV Pitocin, or offering an IM pit to mothers with no IV access post delivery. Evaluation of the plan: nurses are to complete risk assessments and other assessments like IV fundal checks, vital signs, and ensure all documentation is up to date at time of handoff. Nurses are to administer Pitocin per policy. Nurses are to do bedside nurse assessments with postpartum and labor and delivery nurses at handoff. They all had a sheet that they actually had to both sign and turn into the unit managers. Audits of patient charts, and that they were able to keep track of the postpartum hemorrhages of 500 mLs or plus. Nursing implications. Postpartum hemorrhage management has a direct impact on nursing practice. By shaping skills, nursing responsibilities, clinical judgment, teamwork, and providing patient safe culture. Postpartum hemorrhage requires rapid recognition of early signs of increased bleeding. Nursing implications. How nursing roles and postpartum hemorrhage management and treatment affect nursing practice. It strengthens clinical assessment skills by enhancing vital sign trending, improves skills in fundal assessment. It reinforces evidence-based practice interventions, Pitocin administration, the uterine massages and other uterotomics, which are the other medications that are used. It helped improve the IV access for fluid resuscitation or blood products. By holding them accountable, they were more susceptible to actually doing the things and finding time, like flushing the IVs per protocol. It enhances critical thinking. It forces the nurses to prioritize their interventions. And lastly, it improves documentation and legal awareness. Detailed, timely, and accurate documentation with recorded assessment and interventions. Nursing implications. Nursing roles in a postpartum hemorrhage management significantly shape nursing practice by improving assessment and clinical skills, critical thinking and rapid response, evidence-based practice, team communication and coordination, and documentation accuracy and accountability. In conclusion, my quality improvement project demonstrated that timely and standardized use of Pitocin for treatment of postpartum hemorrhage enhance clinical outcomes and support evidence-based nurse practicing. By implementing clear protocol, improving staff education, and improving staff communication, this resulted in an improved hemorrhage control and reduced the occurrence of severe postpartum hemorrhages. This project highlighted the nursing role in recognizing patients at risk of postpartum hemorrhage, medication management, and promoted staff communication. The overall finding supports continued strengthening nurse competency and improving communication to improve maternal health and reduce preventable postpartum care complications like postpartum hemorrhage. Reference page, and thank you for listening.